While your face can look young, but your neck gives away your age. When people think about anti-aging, they almost always focus on the face. They invest in skincare, facials, lasers, injectables, and treatment for the cheeks, forehead, jawline. But one area that is consistently neglected, the neck. Ironically, the neck is often one of the earliest parts of the body to show signs of aging. A person may have a beautifully rejuvenated face, but if the neck has loose skin, horizontal lines, muscle bands, or a poorly defined jawline, the results overall appear imbalanced. As dermatologists, we always evaluate the face and the neck together because they age as one aesthetic unit. Today, I will explain why the neck ages, what changes occur beneath the skin, and which treatments actually work. We will discuss radiofrequency microneedling, HIFU, skin boosters, botulinum toxin, and Mesobotox, along with the science behind each procedure, and more importantly, who is the right candidate for each. Now let's begin with why does the neck age earlier? The skin of the neck is structurally different from the facial thin. It is thinner, contains fewer sebaceous glands, has relatively lower collagen density, and is constantly subjected to movement whenever we talk, swallow, or turn our head. In addition, prolonged sun exposure, gravity, genetics, weight fluctuations, and lifestyle factors such as smoking further accelerate collagen breakdown. Now, over time, several biological changes occur simultaneously. Collagen and elastin fibers gradually decrease, skin becomes thinner and less elastic, hyaluronic acid levels reduce, leading to dehydration. Fat distribution changes. The platysma muscle, it becomes more prominent. Skin laxity develops around the jawline and the neck. Because multiple tissues are involved, skin, fat, connective tissue, and muscle, the neck aging is never caused by a single problem. That is why there is no single treatment that works for everyone. The best treatment, it completely depends on which layer is contributing most to the aging process. Now let's understand what are the common signs of neck aging. Patients commonly notice one or more of the following. First, horizontal necklines. These are also known as necklace lines. Loose or creepy skin, fine wrinkles, dry, rough texture, loss of jawline definition, double chin, jowls which are extending into the neck, vertical neck bands which are also known as platysmal bands. Now each of these develops for different biological reasons. So they require different treatment approaches as well. Now let's understand each option individually. Now let's begin with one of the most versatile collagen stimulating procedures, that is radiofrequency microneedling. This treatment, it combines two technologies. Very fine insulated needles, they create controlled microchannels into the skin, and radiofrequency energy is delivered at the same time into the deeper dermis. This controlled thermal injury, it stimulates the skin's natural wound healing response. Fibroblast cells become activated and they begin producing new collagen, elastin, and extracellular matrix protein. The improvement occurs gradually over the following weeks as the skin remodels itself. It is particularly used for early skin laxity, creepy neck skin, fine wrinkles, mild textural irregularities, and prevention of future collagen loss. Patients generally notice firmer skin, better texture, reduction in fine lines, and improved skin quality. Remember, MNRF does not lift heavy sagging skin or remove fat. Its biggest strength is improving skin quality through collagen remodeling. Next, let's come to HIFU or high intensity focused ultrasound. Now let's move deeper. Unlike MNRF, HIFU works below the dermis. It delivers focused ultrasound energy to specific depths beneath the skin, creating precise thermal coagulation points. This stimulates collagen production in deeper connective tissue and also targets the SMAS layer, the same structural layer that is tightened during a surgical facelift. As collagen contracts and remodels over the next few months, the skin gradually appears tighter. HIFU works best for mild to moderate neck laxity, early jowls, blurring of the jawline, double chin, and early loss of neck definition. Patients should understand that HIFU is not a replacement for surgery. The results are visible and natural, making it ideal for individuals with early aging who want lifting without any downtime. Now let's come to skin boosters. One of the most overlooked cause of neck aging is poor skin quality. Many patients, they don't actually have severe skin laxity. They simply have dehydrated thin skin with fine creases. This is where skin boosters become extremely useful. Unlike traditional fillers that add volume, skin boosters, they contain stabilized hyaluronic acid designed primarily to improve skin quality. Hyaluronic acid has an exceptional ability to bind water molecules, improving hydration from within. Over time, skin boosters, they also stimulate new collagen production, improving dermal remodeling. And skin boosters are particularly effective for horizontal necklines, fine crisscross wrinkles, dry dull skin, loss of skin elasticity, and thin dehydrated neck skin. Patients often notice improved hydration, better skin glow, softer fine lines, smoother texture, and more supple skin. Skin boosters don't significantly lift loose skin, but they dramatically improve the overall quality of aging neck skin. Now let's understand the next treatment, that is botulinum toxin for platysmal bands. Many people believe all wrinkles are caused by aging. True, that is not always true. Some of the most visible vertical bands are actually caused by platysmal muscle, a thin sheet-like muscle extending from the chest to the lower face. As we age, this muscle, it becomes more prominent. Every time we speak, smile, or strain, these bands contract and they become increasingly visible. Botulinum toxin relaxes these muscles temporarily. This softens the vertical bands while maintaining the normal neck movement. It is ideal for visible platysmal bands, dynamic neck wrinkles, early jawline pull caused by platysmal activity. When performed correctly, it can create a smoother neck contour and even produce a subtle improvement in the jawline definition by reducing the downward muscle pull. Now, next procedure that gives excellent results is mesobotulinum toxin is slightly different from traditional botulinum toxin. Instead of injecting deeper into the muscle, highly diluted botulinum toxin is placed very superficially within the skin. The goal is not complete muscle relaxation. Instead, mesobotulinum toxin, it reduces superficial muscle activity while also influencing the tiny muscles attached to the skin. Benefits include softening the fine necklines, improving the crepey neck texture, smoother skin surface, mild tightening effect, and better overall skin quality. It is especially useful in patients whose primary complaint is diffuse wrinkling rather than prominent muscle bands. Now, which treatment is best? This is probably the most common question patients ask. The answer is simple. There is no universally best treatment. The best procedure depends on the underlying cause of aging. If collagen loss is the main issue, collagen stimulation through MNRF is the preferred option. If skin laxity and jawline blurring are dominant concerns, HIFU will provide better lifting. If dehydration and fine wrinkles are the primary concern, then skin boosters improve skin quality beautifully. If vertical neck bands are prominent, then botulinum toxin is the treatment of choice. If superficial wrinkling is diffuse, then mesobotulinum toxin can provide excellent refinement. In reality, many patients have a combination of these concerns. That's why now in dermatology, we are actually moving away from one treatment solutions. Instead, we assess each anatomical layer individually. For example, MNRF stimulates collagen. HIFU improves deeper tissue support. Skin boosters restore hydration and improve dermal quality. Botulinum toxin relaxes overactive muscles. Mesobotulinum toxin refines superficial texture. When these treatments are appropriately combined, the result, it looks significantly more natural than treating only one component of aging. The goal is not to make the neck look different. The goal is to make it look as youthful as the face. If you are investing in anti-aging treatments for your face, but ignoring your neck, you are only treating half the problem. The neck often reveals age earlier than the face because of its unique anatomy, thinner skin, and constant movement. And fortunately, we now have very high effective evidence-based treatments that target every layer involved in neck aging, from collagen loss and skin laxity to muscle bands and dehydration. The key is choosing the right treatment for the right indication rather than simply opting for the latest procedure. If you like our content, then do not forget to subscribe to our channel and please hit the bell icon. If you've started noticing horizontal necklines, loose skin, double chin, visible neck bands, let me know in the comments which concern bothers you the most. I'll be happy to cover those topics in greater detail in the future videos.